if you look at it, and there are 32 teeth in your mouth, and they align with the trigeminal nerve. The trigeminal nerve is one of the 12 cranial nerves that start right into your brainstem here. And the trigeminal nerve actually takes 50% of all the space there, so it's quite important. It goes here, one arm is here, one arm is here, and one arm is here. And the teeth are kind of like at the end of it. And a root canal normally is performed because you maybe break out a tooth, so just keep it there for biting. A root canal will also be performed if you have a big cavity and it hurts like hell and your tooth nerve got infected, and the pain is unbearable because it's in your brain. It is the hell. You need a root canal to get relief of the pain. But if you look at the root canal too, if you look at a tooth from a microscopic structure, a tooth has not just the pulp in it, like these big channels. A tooth is made out of dentin. In one root, you have about, per square millimeter, you have about 70,000 dentin tubules. And if you add those dentin tubules of one root, you add up kind of like having like 0.6 miles or a kilometer of length of tubes where bacteria can live in. Most likely anaerobic bacteria that you don't want to have compartmentalized there. So you have now, because there's no more blood supply, no more immune system in the pulp, you don't have an immune system to attack these invaders. There are studies showing that a natural healthy tooth, because of the pulp and the immune system, is able to defend against bacteria. It's not there anymore. So you have the perfect cave for these microorganisms. They will live in there, making the tooth kind of like chronically infected. If you have an immune system in your body, which you have, and mainly in your mouth, it will do something against it. Macrophages are there to fight against bacteria, viruses, parasites by eating them. So you will have an ongoing chronic silent inflammation done by your immune system around the tooth. Most of the time, around the tip of the tooth, forming a cyst, making an ankylotic process, forming inside cysts, whatever. It's kind of like the cat and mouse. So the cat would be the immune system, macrophages, trying to keep that thing safe, and the mouses being the bacteria lurking inside. Yeah. Also, these bacteria inside the tooth, of course, they have to eat something. They will eat the same thing you do, like amino acids from your food, and metabolize these amino acids through like their byproducts or like their own like their metabolites into high toxic sulfur compounds. It's also pretty clear in research. They are called thioether and mercaptanes. And those things in itself are very toxic for your body, so your liver has to deal with it. But on the other hand, your immune system can become allergic to it. So double whammy, being allergic to a toxin, really bad. So this is one more thing. So immune system, ongoing cytokines through the macrophage activation of the innate immune system, then toxicity of the metabolites, then also it's a dead organ. Everything dead in your body, picture a dead black finger or the gangrenous foot or toe from a diabetic foot. Every medical department will remove the foot because it's clear that this spreads throughout the body. But it's in your mouth, it's in your jawbone, so it's not in your body, so nobody cares. You can just put a cap on top, nobody will see it. It smells, it will rot in there, so a tooth rots over time and builds byproducts of rotting, which are called putrescines and cadaverines, which are in itself, again, highly toxic, puts another burden on your liver and your detoxification system, and you can become allergic. So it was never a good idea to leave a dead body or dead organ in your body. So you have toxicity, you have inflammation, you have immune system, you have cytokines, and you have all this on top of the trigeminal nerve, which is able to transport all toxins, viruses, parasites, bacteria into the brainstem, into ganglia, into hypothalamus, into the pituitary. Within a day. It's called retrograde axonal transport. It was shown in the early 30s by Sturdeberger in Sweden, when he put in mercury into cavities of dog teeth or croton oil, and could show these things in the hypothalamus and brain ganglia and autonomic nervous system. And also with the trigeminal nerve, there's always a part of the parasympathetic nervous system, a little bit of the vagal nerve. And if the vagal nerve becomes toxic, it's called toxic vagus syndrome. And you know what happens then? All your organs will be affected. You will be in chronic stress mode, or you're in anti-parasympathetic, so like you're either in fight or flight, or you're in too much parasympathetic, but you're not in yin and yang and balance anymore. So most of the time you end up being in a fight or flight mode, and you don't even know where it's coming from. And then we're back to root cause and John Fraser and my friends, and you know why this is the splinter that could hold you back. And Thomas Rau had done a study in his patients where he could find, for all his breast cancer patients, he found 94% of his breast cancer patients had a root canal tooth on the meridian that is the stomach meridian, which is going through the breast and female organs. Whereas in healthy population, it was only 30%. So it's not a causation, it's a correlation, but still strong. So for optimal health, you should really consider looking into root canals. But nowadays, we're actually happy to not just have to take out these teeth and do nothing. This is my specialty as a ceramic implant surgeon. I can take out these teeth, clean, disinfect with ozone, do everything perfectly, and place in a ceramic implant at the same time immediately. Why? To keep the structure and anatomy safe. We call that socket preservation 2.0. So you basically never have a surgery. And this is why you come into the all-in-one concept where we do everything in 1 week, basically. And from there, let your body heal and recover and be in the next level of health. Sometimes it's true. I know it sounds crazy and not believable, but it's the truth. It's like everyday business. It's just fun helping these people.